these are bariatric surgeries are either gastric bypass or weight loss surgeries that involve making changes to your digestive system to help you lose weight. And so that being said, we'll bring on Dr. Eusebio now. Good morning, Doc.
Good morning. How are you doing, Chris?
I'm doing a little weird because it's the first time I've had a doctor on, and we're not going to talk about COVID.
Which is I wanted to make sure that I'm not going to talk about that.
Yeah, he's like, first of all, not talking about COVID.
So tell us about this medical procedure that you did and how it all came about.
Well, it kind of, one is that bariatric surgery has been around for quite some time, and going and starting my medical school and my residency training, it kind of sparked an interest in me because I know we like to eat here, and we really adopted a sedentary life, and I always see the complications of people that are obese with like cardiovascular risks in terms of heart attacks, strokes, and it's pretty high on Guam. And it's always kind of baffled me why nobody's tried to establish this kind of, at least an option for people here on Guam. When I came back, which was about 3 years ago, I thought I could, get running and start everything. And of course, everything in life, there are some hurdles. So kind of did take a little time, but my interest really started just because I knew it was something that Guam needed, at least for a lot of people, that as an option.
Mm-hmm. So a patient came in and you kind of did an evaluation and it just became the right time?
Well, it's actually a pretty long process.
Mm-hmm.
One is that you're referred to me from your primary care physician who feels that that you meet the criteria. There's certain a BMI, which is recalculated from your height and your weight, and also kind of the age category, and also the fact that you're a good surgical candidate. And then once your primary care doctor feels that they've tried to do all medical necessary ways for you to lose weight, and you're still not succeeding, then they'll recommend to see a surgeon who can provide you with that service. And then you see me, and then I evaluate you. I talk to you about the options. And I tell you that it's going to be 6 months. It's minimum 6 months. It's 6 months for various reasons. Some of it's insurance. Also, it allows me to get a feel of you, and because this is a lifestyle change and this is a life behavioral change. Because like I tell my patients, I'm like, I can make your stomach as small as possible, but if you like to eat and you keep eating as a tool as a crutch for something that's going on in your life, then I'm not going to help you. So you need to be able to combat that. And in addition, I have you see a dietitian who aids in terms of being able to readjust the things that you're putting in your body. And also we kind of get a feel, and they start realizing the things that they're putting in their body, what's good, what's bad, and how they use food as a crutch. So yeah, it's 6 months. Sometimes it's a little longer because people will, fall off the wagon, and I'm like, you're not ready. So it's been a long process. That actual patient was there I saw her about 8-9 months, because of the COVID issue, and we weren't doing any elective procedures that kind of did kind of push back things. But she did great. She's doing great.
Mm-hmm. So what can we talk about the patient a little bit more then, in terms of when you first met her and you assessed her? I guess what were the determining
what were the
factors?
numbers?
Yeah.
Sure. So again, like I said, there's certain criteria for you to be a candidate. One is that a BMI. So BMI, like I said, you calculate it from your height and your weight. Typically, patients that are morbidly obese, they're like a BMI of 35. So you have to have a BMI of 35 with some comorbidities, say like diabetes, hypertension, high cholesterol, all those things, which a lot of people do have. And then you meet the insurance criteria. And then I want to talk to you again and see how serious you are about this. And some people are like taken aback because they think they're going to see me and they're going to go, get the surgery and then they're going to go home, which is not the case. And I tell them that I'm going to be with you. This is like a marriage. I'm going to see you. We're going even after the surgery. This is going to be a long time kind of thing. So it's going to be a process.
So what was her, I guess, her starting weight? And then, I guess,
Uh,
did she have to lose
she
weight
was
before?
around, yeah, she was around a little over 220. I think she was around 5 feet. She's now, the last time I saw her, she's 180, a little change. Yeah, it's about 2.5 months.
Wow.
But the most important thing, like I said, was the fact that she's diabetic. She's on 2 diabetic medications, and she's also hypertensive. And she takes 1 medication. She hasn't been on any of those medications since surgery.
Wow.
Did she have to lose any weight prior to the actual
Yeah,
surgery?
yeah. So I
Mm.
tell them.
So you're not
I
just
said,
like,
you need-
I'm having the surgery. I'm just gonna go to every fiesta and eat everything.
No,
because I'm gonna-
no. I do because I tell them, you got to meet me halfway.
Mhm.
I'm not telling you. I understand. This is an issue, and I'm not expecting you to lose. The 80 pounds or 90 pounds that the surgery can provide. I need to show some effort. If I see you and you're gaining weight, you're not showing me that. And like I said, it is behavioral changes. So I don't have like a set number. I kind of change it for each patient, but when I do see them and they're losing a pound or 2 every meeting I have, then that shows me that they're interested. But when they're not, I'm like, dude, you're not showing me any effort.
So so how much weight did she lose before the surgery?
For the surgery, she would bounce around. So I think that's why, again, that's why it took a little longer.
Mm-hmm.
She would lose about 5 pounds, then she would gain a pound, then she would lose about 3, and then gain a pound. And again, it's a very difficult time. I know I don't want to talk about it, but it is about COVID, with the stress of kids being at home. And so, and I'm like, I get it. I got 2 kids too. It's tough. You can't go and exercise. You can't go to the store and get all the things that you want to get. So definitely a little bit more lenient, but she still kept trying, and she's very motivated. She's one of the most motivated persons I met. So,
Doc, when you talk about those numbers, 5 foot, 220 pounds, pre-existing comorbidities, that sounds like almost everyone I know.
Yeah, I know. But I'm not saying that this surgery is for everyone. That's the one thing, and everybody needs to understand that. It's good for selected people. Like I said, I can make your stomach small, but you got to be able to make this commitment. And some people are not good surgical candidates. I mean, they've had heart attacks or strokes in the past, and then I don't want to put you at risk. My biggest fear, because this is purely elective, is I don't want to I want you to be able to walk out of the hospital with no issues. I don't want you to leave the hospital with bigger issues. So I want to make sure it is a safe procedure, and that you're going to improve and be better off with it. So yes, there's a lot of people on Guam like that, but a lot of people are not good surgical candidates for it. And that's why you have this little process. That's why the primary care physicians make that distinction to who they think will be good. And then I kind of do another tier of little filtering out. And then also with the aid of the dietitian, we kind of make a good assessment and see who can go forward.
So you said she had the surgery, she lost the weight. What about the health, the comorbidities?
Right.
Is she better now?
I'm sorry.
Does she still have diabetes?
Is she better now?
Yeah. Like you said, she had comorbidities. Diabetes.
She's in term like remission. So we're still of course need to follow her, because we're gonna need to follow her hemoglobin A1C, which is a number that can kind of dictate what your blood sugars have been for the past 3 months or so. But when she does do her daily glucose checks, it's all below that range where she doesn't need to take her medications, because if she did, she'd bottom out. And she has a blood pressure cuff, which she's taking daily, and her blood pressures haven't been high enough to take the medication. So she's in remission.
Okay.
Oh, goodness. How many other candidates are you currently looking at for this procedure?
Well, we were getting, of course, with that press release, people are a lot more interested. I started seeing people 2 years ago. I actually saw 16. Only her came through. Again, a lot of people see me after 2 months, and then they're like, they don't come back for another appointment. So I call them, and they're like, oh, I'm going to make another appointment. And again, it's not for everyone. A lot of people want to have that quick fix, and that's not what it is. and I want to make sure that this is a lifestyle change, because it's a big deal. It's a big deal. I mean, a lot of people look at food and as a crutch, and you literally cannot eat that much. If you do, you are going to get sick. Like, you will get sick, and it scares people. So it's a change. It's a change, and it's a change that is necessary for those particular people, because there's such a big risk of having early heart attacks, early strokes. So there has to be a big change in terms of, and this is the option.
How do we get on the fast track, though? I mean, you're talking about this procedure is not a fast track. Are those options also available on Guam? I'm not even familiar with whatever procedure it would be.
Which one? I'm sorry.
When you talk about this procedure not being the fast track, what about other options? Do we do lipo here and all that?
Well, lipo, lipo is just all pretty much cosmetic. So you're just really taking out the superficial stuff.
Asking for a friend, Doc. I'm asking for a friend. All right.
Okay. No, man, Chris, you're not. I can't. You just got. So I mean, a lot of people it's no fast track for this. Exercising and diet works a lot for people, but as we all know, you gotta be disciplined, because the longevity of it, and that's the thing, is the longevity. People yo-yo, so they do a great job for the first 5 months, and then all of a sudden you have a stressor, and then you gain it back.
Yeah, so, starting to feel attacked here, Doc.
Never, Chris, never.
Right. No. So how do people get a hold of you? Any potential candidates? I know there are people listening right now, and they're hearing exactly what you're saying, and they want to get involved.
My recommendation are for anyone that is interested to talk to your primary care physician, and then if they feel like they are that the primary care feels that you are a good candidate, and then they can always send you a referral to me, and then I'll evaluate you. Ultimately, I would love to start get an actual existing program, which we will eventually have in the future. But right now, we're very much grassroots, and we're kind of just outreaching all the community docs to try to help out. But we'll get there.
All right. Well, thanks, Doc.
Yeah.
Congratulations.
Of course. Thanks, guys.
All right.
There's Bertrand Belelis Dogu on your way out of the KUM News Zoom room if you want. It's the last of the batter. Okay.
We just talked about eating healthy, and
that's kind of healthy. It's air fried. It's air fried, Doc.
There you go.
Okay.
All right, guys.
See you. Take it easy. Happy New Year. Right on.
Asking for a friend.
I'm just asking for the people out there. They want to know. 8:57. We can keep it going in the KUM News Zoom room.
Sure.
Yeah. Okay.